Hello, this is Dr. Grande. Today's question is, what is the difference between PTSD and C-PTSD, or post-traumatic stress disorder, versus complex post-traumatic stress disorder? Well, first, it's important to recognize here that PTSD is an official mental health disorder in the Diagnostic and Statistical Manual, the DSM. So a diagnosis of PTSD can be given if someone meets the full criteria for that disorder. C-PTSD is more of a concept. It's not an official mental health disorder. And really, there's a lot of overlap between PTSD and C-PTSD. So first, I'll briefly talk about PTSD, and then we'll look at the differences between PTSD and C-PTSD. So with PTSD, there are a number of symptom criteria. I'm not going to go over all of them, but I'll give a summary as to what we see here in the definition for PTSD. So first, we need a qualifying trauma for post-traumatic stress disorder, and that could be directly experiencing a trauma, witnessing a trauma, and there's some other circumstances that could occur there too. We see symptoms of intrusion, like distressing memories, distressing dreams, flashbacks. We see symptoms of avoidance, like avoiding reminders of the trauma or trying to avoid thoughts and feelings associated with the trauma. We see negative mood symptoms, like a negative emotional state, for example, fear, guilt, or shame. And also we see when an individual can't experience positive emotions. That's part of that negative mood group. And then we see symptoms of arousal. So this would be anger, hypervigilance, or a sleep disturbance, for example. Now, complex PTSD is somewhat similar, but the differences start with the trauma. So with PTSD, as I mentioned, there are a number of potential qualifying traumas. With C-PTSD, the trauma is usually considered repetitive or continuous. So a lot of times when we think of the trauma associated with C-PTSD, we think of child physical abuse, child sexual abuse, or some other type of trauma that occurs repeatedly and usually during childhood. Now, some other differences in terms of the symptoms with C-PTSD are similar to PTSD, but the severity, frequency, and duration would be considered greater with C-PTSD. So with complex PTSD, we see difficulty with emotional regulation, like anger and sensitivity. There are symptoms related to consciousness, like dissociation, for example. And of course, we do see this with PTSD, but again, it's considered more severe with C-PTSD. We see differences of self-perception, like shame, guilt, and consistently negative self-concept. We also see with PTSD distorted perceptions about the perpetrator, like a preoccupation with revenge or a focus on the nature of that relationship with the perpetrator. With PTSD, sometimes there would be a perpetrator as well, but we usually think of it differently with C-PTSD, that it's the same perpetrator over a long series of traumatic events. Also with PTSD, sometimes of course there is no perpetrator, like a motor vehicle accident with only one car, or a natural disaster, or a medical emergency. None of these would necessarily involve a perpetrator. With C-PTSD, we see difficulties with relationships, interpersonal relationships, particularly distrust and isolation. And also we see a loss of meaning. In particular, hopelessness is fairly common with C-PTSD. So as we can see, there are substantial similarities between PTSD and C-PTSD, and some notable differences. And the question I hear sometimes around this is, do we even need C-PTSD? We don't have it as a mental health disorder right now, although it's being proposed for ICD, which is another publication that's similar to the DSM. But of course, right now we don't have the disorder, and do we need it? And this is a complex question because it has to do with why we create distinct classifications in the first place. And usually the reason is because the clustering of symptoms is distinct and needs to have an independent treatment protocol. The treatment would be quite a bit different than what we'd see for another similar disorder. I think there is fairly good evidence that C-PTSD is a distinct construct. We do see presentations of C-PTSD that seem quite a bit different than PTSD. It's not clear if the treatment is altogether different for CPTSD versus PTSD. Although, of course, treatment for CPTSD would usually involve those other factors like the interpersonal relationships and distorted perceptions of the perpetrator and a few others. The question really becomes, can that treatment just be incorporated with a diagnosis of PTSD? Does there need to be that separate diagnosis? So I don't think there needs to be to provide the treatment, but at some level, with further research, we might discover that the distinction is greater than we think right now, and it would make sense for this to be an official mental health disorder. It's really unclear at this time, and if you look at the research, there are a lot of opinions in a lot of different directions. Another issue is how CPTSD relates to borderline personality disorder, and I'll cover that in a separate video. So for right now, I think further research is warranted, although I do see the merits of a distinct classification for CPTSD. I hope you found this description of PTSD versus CPTSD to be interesting. Thanks for watching.